Well, the past couple of years, many people put off getting annual physicals and screenings. Now it's time to get your health back on track. Today, we've got nurse practitioner Richard Morrow with LeBauer Healthcare at Summerfield Village. He's here with us to kind of review the screenings that you need most and why do you need them. All right, let's start with how important the annual physicals or wellness checks are.
Yeah, the annual physical is an essential portion of health maintenance. Annual physicals are key in early detection and prevention and just touching base, making sure that we can take these early steps to get your health on track and prevent anything bad from happening.
Okay, and I think a lot of times people they think to themselves, I just feel fine. I don't really need to have this done. Why do we need to go every single year?
Right. I hear that a lot from patients. Why do I need to have this lab work done? Why do I need to come back in to have my blood pressure checked? Well, you might not feel your blood pressure if it's just a little bit too high. You probably can't tell if you have high cholesterol, but you certainly can tell if you have a heart attack or you end up with other adverse health events later on. By taking these steps at these visits regularly, annually, or even more frequently if you have health concerns, we can hopefully head off any of those adverse events before they happen.
All right, and so who needs the wellness check? Are we talking about kids only because they're changing so much and growing, adults, both?
Everybody, everybody should come in at least once a year to their primary care, a family doctor, their internal medicine doc, whoever they see on a regular basis, just to make sure that everything's still going smoothly. It's certainly, like I said, sometimes it's the things under the hood that you just don't notice, and those are the things that folks in primary care like myself are trained to pick up on.
Okay, so that's the primary care doctors, but a lot of adults have kind of gotten off schedule with their screenings as well. We're talking mammograms, we're talking colonoscopies. How concerning is it that people have kind of like been going away from those types of screenings?
Yeah, it's very concerning. It's very concerning. Certainly, COVID's been the hot topic over the past few years, and that, doesn't necessarily mean that colon cancer or breast cancer has gone away. Certainly, nobody looks forward to a mammogram or a colonoscopy, but it's crucial to get early detection on board. It's early detection and early intervention in these disease processes is a huge determining factor in how successful treatment will be.
All right, let's talk about some of the do's and the don'ts kind of thing, the health checklist. We're going to go down men, we're going to go down women, we're going to go down children. I know we all have some of the same things, but there's some different things too. How about for men?
For men, certainly want to make sure colon cancer screening is on board for folks 45 and older. For folks 50 and older, recommend prostate cancer screening. Then, of course, routine labs, things like blood counts, liver and kidney function, cholesterol checks, certainly things that we want to keep an eye on.
All right, and then let's go for women.
And for women, of course, mammography every year is typically recommended, certainly sooner if there's any abnormalities. Cervical cancer screening with their primary care or women's health specialist every 5 years for normal results from anybody from the ages 21 to 65. And then bone density screenings for women in postmenopausal age range or women who are at higher risk for fractures.
All right, and then let's talk about our kids. I mean, I think we take our kids to the doctor, like if they need a certain like immunization or, if something is wrong, but not anytime else.
Right, and certainly kids are always tough. Kids have a tough time vocalizing their concerns. Sometimes it's easier for them to speak with healthcare providers and speak with those of us who are more in tune with the way kids tend to talk about their health concerns. Certainly, regular vaccinations still crucial for children. Certainly, things like meningitis haven't gone anywhere. Things like HPV are still causing health concerns in our children and young adult populations. So certainly important for those folks to stay regularly in touch with their primary care provider.
All right, so you got families at home who are listening to this. Maybe they're thinking, all right, I got some things on my checklist I need to do. I know the husband or the kid has something on their checklist, and they have not been doing these wellness checks. Where do they start again? What should they do?
Find a primary care doc that fits your needs. Certainly I understand it. I think everybody knows the sort of intimacy in healthcare and how important it is to find somebody that you really gel with. And so, make that search, take those steps. Conehealth.com/appointments is a great place to start. That will guide you through providers that are accepting new patients, offices that are accepting new patients. Once you get in with a primary care provider, remember, it's better late than never. Certainly, I know folks have sometimes concerns that it's been so long, and Well, how do I get back on board? Make that appointment and come on in. We'll take care of the rest.
All right. I do want to talk about the prevalence of like heart disease, especially since we're in that month, but we're going to take a quick break first. But we want you to know, folks at home, that we're going to be talking about heart disease since it is this month, and we'll be back in just a few moments. We are back with Cone Health, and we're talking about your wellness checkups in this 2-year well-being. And we're talking about the prevalence of heart disease. And this is, of course, is Heart Disease Awareness Month. Why should it be a priority for all of us to be paying attention to it, especially if we don't have family history?
Right. Well, heart disease is something that claims the lives of near 700,000 Americans every single year. Frankly, it's one of the more prevalent, chronic conditions, and it's a huge impact on quality of life. And certainly, it's one of those things that you take care of your blood pressure and your cholesterol early on, and maybe it's not something that you'll face later on. It's risk factors are always changing. It's always important to keep an eye on those metrics early on to prevent any adverse events later on.
All right, let's talk a bit of the prevention strategies for warding off heart disease. First and foremost is eating a healthy diet, and that looks like?
A lot of different things are considered a healthy diet. Certainly, in this day and age, you can hop on the internet and find just about any kind of diet can be healthy. In general, my recommendations are limiting processed foods, are controlling portion sizes, and eating mostly plants, fruits, veggies, nuts, seeds, legumes. If you have a pretty colorful dinner plate, you're probably going to get a wide variety of nutrients, and if you have plenty of fiber in your diet, going to do great things for your cholesterol and your blood sugars.
Yes, if everything is just like that shade of like pale, like not quite white or something like that, you're talking about that is not what we're looking for.
Not exactly. No, the typical meat and potatoes diet, unfortunately, as much as it is a standard for a reason, is not necessarily the reliable diet for heart health.
Okay, so and then being physically active, and people always want to know, okay, well, how physically active do I actually have to be?
So the American Heart Association recommends about 30 minutes of exercise 5 days a week at a minimum. So 150 minutes of exercise total. Exercise, well, what is exercise? Is it running? Is it lifting? No, exercise can be anything that gets your body moving, that gets your heart beating a little bit faster than it is at rest. What I always recommend to patients is find exercise that you enjoy. If you don't like running, don't run. Do yoga, swimming, you can walk, you can find something that gets your body moving, that you enjoy it, that you'll keep coming back to over and over again to stay active and maintain those healthy habits.
Okay, and then one of the big things, of course, is to stop smoking. And does this include vaping and all other kinds of tobacco products like dipping and things of that nature?
In reality, the only thing that should be going into your lungs is fresh, clean air. Anything else is going to be sort of an insult to that tissue and risk damaging those lungs. Of course, these vape pens and e-cigarettes are new, certainly a lot newer than traditional tobacco products like cigarettes and cigars. And so we don't really have a lot of long-term data on those. But what we've seen so far is that while they may be better than cigarettes, they're really not all that great.
Okay. What age should we start thinking about heart health and making these steps a priority? Because I think we think, over the age of 50 maybe, or over the age of 60.
I start screening for cholesterol, for blood pressure, and really keeping a close eye on those things for patients in their early 20s. It's really once somebody's reached adulthood, that's when I start to get concerned that this might be something that starts catching up to them. Especially with folks who might not know their entire family history. They might know, well, my grandfather had a heart attack, and I don't know how old he was. It was before I was born. Well, that could have been in his 40s or in his 50s, and that's something that we really want to take steps to prevent starting in patients' 20s.
All right, because people will say, well, I can't change my history, my medical history, and what my family had or whatever else. So why does it help that much? And that is just so that we can do some preventative things.
Exactly. There's never been a better time through all of human history to be sick or to need any medical attention than there is right now. We have so many options for therapies, both medical and otherwise, that can help prevent these adverse health events.
All right, and so what types of family history would be good to know? I mean, obviously, if someone had a stroke or a heart attack, but are there other things?
Sure. Any high cholesterol, certainly any high blood pressure, any early deaths, unexpected deaths in the family history, certainly looking for a history of cancers. And while not all cancers are genetic, there are a fair few and certainly trends that we want to establish. And, any other relevant family medical history is really something that we can draw on if we need to, depending on how a patient's presenting and what concerns we have going forward.
Okay. And one last thing, we just had this discussion at work not too long ago about eye exams. And someone said, well, my eyes are fine. Why do I need to go get an eye exam?
Well, certainly eye exams more than just your vision. We want to make sure the pressure in your eyes is okay. Glaucoma can claim your vision pretty quickly if we don't look out for it. Beyond that, not a lot that we like to, delay as far as age-related changes. Uh, hey, I know my dentist would be dismayed if I didn't mention a regular dental cleaning every six
Right.
months. Nobody
Okay.
likes it, but it's got to get done.
Good to know. All the wellness checks. All right. You can find all of this information in the To Your Wellbeing section.